Hey everyone, I'm Dr. Del Rosario, a community oncologist passionate about cancer care. I started this YouTube series to discuss common cancer myths and debunk them for patients, families, and their caregivers. The goal of this series is simple. I want to educate patients and their families to make better healthcare decisions for them and their loved ones. So tune in, like, subscribe for more, and let's get into it. So, is cancer contagious? No. And let's break it down. In today's episode, we'll discuss why cancer is not contagious, what actually is contagious, why this cancer myth persists, and calls to action that you can take for you and your families. Can cancer spread from person to person? No, it can't. It's not like other things that can spread, such as viruses, bacteria, and fungus infection. For example, respiratory flu, it's getting cold now. And I do recommend, on a side note, to get your flu vaccine to prevent yourself from getting a terrible flu infection. But flu is a respiratory illness. It spreads through aerosols, what you breathe, droplets when you sneeze, and even fomites where the virus can live on certain inanimate objects and not spread through that way. For example, if you touch like a door handle and you rub your nose, you can actually get a type of flu virus. But cancer is not. Cancer typically grows by itself. What cancer is actually an abnormal growth or proliferation of cells. So, for example, your cells grow all the time in your body, like your hair, your skin, and even your organs inside your body, like your lung, liver, bones, nerves, etc. And as things grow, the cells basically grow, divide, and die. Cancer, unfortunately, has a mutation most of the time. It either grows so quickly that the body can't keep up with destroying it or getting rid of it, or cancer is unable to die, like immortality. In cancer care, we, as oncologists, we like to think of this, the gas pedal on the brakes. For example, when you're driving a car, you have a broken gas pedal, basically it's a vroom, 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 the cancer cells keep growing and growing. Or the other option is sometimes the cancer cells don't have the brakes. So when you are driving and then the brake is broken, you can't stop. So that's similar to cancer growth in that sense. But that doesn't tell the whole story. What are common exceptions? There are, as I said before, things that are contagious, can spread from person to person, are viruses. And there are certain types of viruses that increase your risk for developing cancer. And what do I mean by risk? It doesn't mean that if you get this certain type of virus, you get more cancer. Instead, you just have an increased risk for developing the cancer. It's similar to if you were smoking cigarettes. Not everyone who smokes cigarettes gets lung cancer, but if you do smoke cigarettes, you might get lung cancer. You have a higher chance of getting it. And also drinking alcohol. If you drink a lot of alcohol, not everyone who drinks alcohol gets liver cirrhosis or liver failure, but if you do drink a lot of alcohol, you do have a higher risk of developing liver cancer. So what are these viruses that can increase the risk? One common one is something called human papillomavirus, or HPV. You might know this as the virus that causes ugly warts that you could sometimes see on your hands or your feet, like common warts or plantar warts. That's the common one. But there are certain types, because not all HPV or human papillomaviruses are the same. There are certain types that develop cancer. And if you spread these HPV or human papillomaviruses in certain areas, for example, in women, you can get a type of cervical cancer if someone were to spread HPV through sexual contact into your cervix area, or even men and women, they could get certain types of throat or esophageal cancer spreading HPV. It could also be laryngeal or any type of head and neck cancer, and you could spread like the HPV virus. And that is rare. And that, once again, just because you get that certain type of virus, that you do develop that cancer. Another one that we hear a lot is hepatitis. Hepatitis B and hepatitis C are what we call blood-borne illnesses, meaning that they spread through the blood. So how do you spread from blood from somebody to somebody else? It would be commonly in today's day sexual contact. You could spread hepatitis B and hepatitis C through some type of sexual contact because you're breaking that barrier between two people, and you could spread someone's blood to somebody. So if somebody had hepatitis B or C, they could spread hepatitis B or C to somebody else through sexual contact. Another method is sharing needles, like for illicit or recreational drug use, like methamphetamine or heroin. A lot of times people would shoot up and then they would share that same needle to somebody else. And if that person had hepatitis B or C, they could spread that virus to somebody else. And hepatitis B and C are what we hear about because they do cause liver inflammation or hepatitis. And in end-stage causes, it can cause what we call liver cirrhosis. Liver cirrhosis is failure of the liver. And even end stage after that, you guessed it, if you can develop liver cancer from developing hepatitis. Another common one we hear in today is Epstein-Barr virus. This is known as mono. I must preface, mono is actually very common. You do see it in more than half the people in the United States have had some kind of contact with mono. And once again, it doesn't mean that if you get mono, you're going to develop cancer. But there are very rare cases where mono, untreated, can lead to certain types of lymphoma. So that's just something to be aware of when you ever get mono and talk to your doctor. So there are other rare cases of developing cancer in like organ transplantation. So for example, if somebody had liver cancer and donated to their liver to somebody who actually needed it, they could develop that same liver cancer that patient had. And kind of makes sense. That's why we have a lot of very stringent protocols on organ transplantation. We have a lot of tests that need to be run to rule out cancer and other types of infections so that patients can qualify to be an organ donor or even an organ recipient. This myth persisted because in the day when we first started doing organ transplantation, they did report that in the literature. But it's actually extremely rare, if not unheard of, in today's modern medicine. So if we debunked all these myths, why does it persist today? How we've seen it in my other episodes, that cancer myths are common and they can persist. And especially with the way the human brain is made, you are afraid of something, or if you don't know about anything, the fear can kind of make you think twice, like, hey, can cancer be spread and be contagious? But actually in today's day and age, it's not. And that's why I'm here today, because I want to debunk this common cancer myth. I want to make sure that patients and their families know that cancer is not contagious, and really steer away from your loved ones or friends and family just because you have cancer. Avoid anyone that you care about that does have cancer. What's more important, I believe, in my opinion, is what we call social support. And I feel, and I've seen anecdotally, that patients do a lot better when they have a lot of strong family, friends that are always there for them. So if you or your loved one has cancer, don't avoid them. Try to be there with them, because cancer is a tough battle. You want to minimize all the battles that you are doing while you have cancer, especially when you have a cancer myth. And I'm just really here to spread accurate information so you can be there for your friends and family. So if you like this video, subscribe for more. And next week we're going to debunk another common cancer myth, which will be tuned in later.